Hello, Mr. John. How you doing?
Hello, I'm not doing good today.
Oh no. Well, my name is Keith. I'll be your LPN today. So talk to me. What's going on, my friend?
Well, I came in to get some education and some knowledge
Okay.
about uh, cancer.
Yeah.
And my father died of testicular cancer a while
I'm
back,
sorry to hear that.
and I'm having some issues in my private area,
Okay.
and I wanted to know what I'm supposed to be experiencing. Maybe you can tell me something about what testicular cancer is.
Okay. And this might look a little silly, so bear with me. But basically, this is your genital area. You have your penis where urine and semen, all that comes out. And then down here you have your testes, which is another word a lot of people use as balls. And here in your testes or your balls basically is where your semen or your sperm is formed, as well as hormones.
Does the scrotum cover your testes?
Exactly. Very good. 100% to you. And basically, when the cells in your scrotum or in your testes, the way they're made gets altered, the formation gets altered, that could build to cancer. Do you know how to check your testes or how to do a self-exam?
No, nobody's ever showed me that.
Okay. Very simple. Very, very simple. At least I consider it simple. Once a month, you try to keep it the same day each month around the same time. I recommend after a nice shower because everything is soft and easy to, get around and whatnot. For this example, I'm using one hand, but you try to use both hands to kind of feel around. And it's the size of it's basically like holding a small egg. And it's firm, but it's not hard. And you want to feel around for any kind of masses or just swelling, any kind of pain or discomfort that you feel. Some people I've heard, if it feels like you're touching a piece of rice or whatnot, that's a sign of like a mass on your testes, which should be reported immediately. So it's good to keep track of each month and even document, write it down, make a journal of if you feel anything or if you don't feel anything, and immediately come talk to Dr. Smith over here, and he'll kind of tell you what's next. Okay, does that make sense?
It does. Thank you.
Okay. Do you have any other questions?
If I do have cancer
Okay.
or something leading toward cancer,
Mm-hmm.
what is out there to help me?
Well, the Dr. Smith, when he comes in and you talk to him about what's going on as well, he will actually tell you what would be the next logical step for your case, particularly, because he'll more than likely do a physical exam, which is basically the same thing as your self-exam, what we just talked about, but he's going to do it and try other things out and see what he sees. He may order an ultrasound, which is similar, it's like the cousin of an x-ray, where you go in and you get visual images of, well, in this case, of your testes, and it kind of shows more three-dimensional images of the testes and shows any masses, abnormal scans or whatnot.
Mm-hmm.
And something just to point out particularly, which some people think, oh my gosh, one scrotum is lower than the other. Is that normal? In most cases, yes, actually. That's just kind of how we're made, and not every man's testes are the same. So now, if one's lower and you're feeling pain, that needs to be reported immediately, because that could be signs of cancer or inflammation or whatever it may be. So report anything abnormal or different to your doctor immediately. Or the ultrasound, and if they find anything, they may decide to remove the testy, and which is a castration of the testy, but say removal of the testy, which you can live off of just one testy. It produces sperm and whatnot as well, so your sex drive is still good to go. And if they decide if the cancer spreads, they may decide to remove both testes, which if that's the case, your sex drive does go down. However, they do have hormonal replacement therapy, which is injected into you, which helps improve your sex drive.
Okay.
So hopefully this all makes sense. Do you have any questions?
It does. Well, I'm definitely going to talk to Dr. Smith, and thank you for educating me.
Absolutely.
Much appreciated.
And you have a great day, okay?
You too.